Kidneys are important because they clean your blood, keep your body's fluids balanced, and help control your blood pressure. Keeping your kidneys healthy is really important for staying well. But did you know that some everyday medicines can hurt your kidneys, especially if you don't use them correctly or take them for too long? This video talks about 7 of these medicines, how they can affect your kidneys, and gives tips on how to use them safely. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are common painkillers like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. They help with pain, inflammation, and fevers. NSAIDs work by blocking certain enzymes called COX enzymes, which are involved in making prostaglandins. Prostaglandins protect your stomach and help keep your kidneys working well by ensuring good blood flow to them. Without enough prostaglandins, your kidneys might not get enough blood, which can be harmful. Using NSAIDs too often or for too long can lower the blood flow to your kidneys, which can cause sudden kidney problems, acute kidney injury, or long-term kidney issues, chronic kidney disease. People who already have kidney problems, high blood pressure, or heart failure are more at risk. Signs that NSAIDs might be harming your kidneys include peeing less, swelling in your legs or ankles, and higher blood pressure. Tips for safe use limit. Use. Only take NSAIDs as directed, and avoid using them for a long time unless your doctor tells you to. Hydration. Drink plenty of water when taking NSAIDs to help your kidneys work well. Monitoring. If you need to use NSAIDs for a long time, have regular blood tests to check your kidney health. ACE inhibitors and ARBs. ACE inhibitors and ARBs are medications often used to treat high blood pressure and heart failure. ACE inhibitors like lisinopril, Prinavil, Zestril, and enalapril, Vasotec, and ARBs such as losartan, Cozar, and valsartan, Diovan, work by relaxing blood vessels and lowering blood pressure. They do this by blocking the renin-angiotensin-aldosterone system, RAAS, which is a system in the body that helps control blood pressure. Although ACE inhibitors and ARBs help many patients, they can sometimes harm the kidneys, especially in people with existing kidney issues or those taking other medications that affect kidney function. These medications can lower the glomerular filtration rate, GFR, which might lead to high potassium levels, hyperkalemia, and sudden kidney problems, acute kidney injury. Tips for safe use. Regular monitoring. Get regular blood tests to check your kidney function and potassium levels. Dose adjustment. If you have kidney problems, talk to your doctor about adjusting your medication dosage. Hydration. Drink enough water to keep your kidneys working well. Diuretics. Diuretics, also known as water pills, are medicines used to treat conditions like high blood pressure, heart failure, and swelling, edema. They work by helping your body get rid of extra salt and water through urine. Common diuretics include furosemide, Lasix, hydrochlorothiazide, HCTZ, and spironolactone, Aldactone. Using diuretics too much or in the wrong way can cause dehydration and imbalances in electrolytes, like sodium and potassium. This can put stress on the kidneys and might lead to sudden kidney problems, acute kidney injury. Signs that diuretics might be harming your kidneys include peeing less, feeling confused, and having muscle cramps. Tips for safe use. Proper dosing. Take diuretics exactly as your doctor tells you, including how often and how much to take. Hydration. Drink enough fluids to stay hydrated and help prevent dehydration. Monitoring. Get regular checks of your electrolyte levels and how well your kidneys are working through blood tests. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, like omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, are often used to treat acid reflux, stomach ulcers, and GERD. They work by decreasing the amount of acid produced in your stomach. Using PPIs for a long time has been linked to a higher chance of chronic kidney disease and sudden kidney problems, acute kidney injury. The exact reason isn't totally clear, but PPIs might cause a condition called interstitial nephritis, which is when the kidney's tubes become inflamed. Tips for safe use. Short-term use. Use PPIs for the shortest time needed to control your symptoms. Consider alternatives. Think about other ways to treat acid reflux or GERD, like changing your lifestyle or using H2 blockers. Monitoring. If you have to use PPIs for a long time, check your kidney function regularly with tests. Antibiotics. Some antibiotics, like aminoglycosides, for example gentamicin and tobramycin, and vancomycin, can harm the kidneys. This is because they are nephrotoxic, which means they have the potential to cause kidney damage. These antibiotics are usually used to treat very serious infections. Aminoglycosides and vancomycin can cause sudden kidney problems by harming the kidney's filtering parts, which can lead to a condition called acute tubular necrosis. Signs of this may include making less urine, swelling, and higher levels of creatinine in the blood. Tips for safe use. Use appropriately. Take antibiotics only as prescribed and when needed. Dosing and duration. Follow the prescribed dosage and duration exactly. Monitoring. Keep an eye on your kidney function, especially if you're on antibiotics for a long time. Lithium is a medicine often used to treat bipolar disorder and other mood problems. It works by influencing chemicals in the brain that affect mood. Using lithium for a long time can cause nephrogenic diabetes insipidus, NDI, where the kidneys can't concentrate urine properly. This leads to making a lot of urine and can cause dehydration. Long-term use of lithium can also lead to chronic kidney disease. Tips for safe use. Regular monitoring. Get regular checks of your kidney function and lithium levels in your blood. Hydration. Drink enough fluids to help prevent kidney problems. Dose adjustment. If needed, talk to your doctor about adjusting your lithium dosage for better safety. Antiviral medications. Some antiviral medications like acyclovir, Zovirax, and tenofovir, Virayad, which are used to treat infections caused by viruses such as herpes and HIV, can impact kidney function. Cyclovir can lead to crystal-induced nephropathy, where crystals form in the kidneys, causing blockages and damage. Tenofovir can cause proximal renal tubulopathy, which harms the kidney's tubules, causing phosphate loss and reduced kidney function. Tips for safe use. Adequate hydration. Drink plenty of water to reduce the risk of crystal formation when using acyclovir. Regular monitoring. Keep track of your kidney function and adjust the medication dosage as needed. Consider alternatives. If you have kidney problems, discuss alternative antiviral medications with your healthcare provider. Conclusion. Medications play a vital role in treating many health conditions, but it's important to know how they can affect your kidneys. Being aware of the potential risks of common medications and taking precautions can help protect your kidney health. Always consult with a healthcare provider before starting or changing any medication, and regularly check your kidney function if you're on long-term medication. By staying informed and proactive, you can safeguard both your kidney health and your overall well-being. Additional tips for kidney health. Stay hydrated. Staying hydrated is essential for kidney health. Drinking plenty of water helps flush out toxins and waste products from your blood, supporting kidney function. Aim for at least 8 glasses a day, more if you are active or in a hot climate. Proper hydration maintains fluid balance, supports kidney blood flow, and prevents kidney stones. Clear or light yellow urine indicates effective waste filtering. Balanced diet. A balanced diet is essential for healthy kidneys. Eat a variety of fruits, vegetables, whole grains, and lean proteins to provide vital nutrients. Limit processed foods high in sodium, sugar, and unhealthy fats, as excessive sodium can cause high blood pressure, a kidney disease risk. Control protein intake, especially from animal sources, to reduce kidney strain. Choose plant-based proteins like beans, lentils, and tofu for a kidney-friendly diet. Regular checkups. Regular medical checkups are crucial for early detection and management of potential kidney issues. Tests during these visits, like blood and urine tests, monitor kidney function. Early detection allows for effective treatment and prevents further damage, especially if you have risk factors like diabetes or hypertension. Personalized advice from your doctor can help maintain kidney health. Avoid excessive use of over-the-counter medications. Be cautious with over-the-counter medications, especially NSAIDs like ibuprofen and naproxen, which can harm kidneys if used excessively. Use them sparingly and as directed. Consult your healthcare provider for long-term pain relief options to protect kidney health. Monitor blood pressure and blood sugar. High blood pressure and blood sugar are significant kidney disease risks. Manage these conditions with lifestyle changes and, if needed, medications. Regular monitoring helps maintain healthy levels and adjust treatment plans as necessary.